TN.
Now, for Kipsomba Ward MCA Mary Goreti Boroswa, every public baraza is personal. For 27 years, she's lived with HIV, and now she's turning her private battle into a public mission. From church halls to market centers, her message is blunt. Parental silence on sex is fueling a surge in new infections among young people. Goreti openly accuses many parents of negligence and a lack of advocacy on sexual health matters. And as Elvis Koskei now reports, adolescents and young people aged between 15 and 24 years of age continue to account for over 40% of new adult HIV infections. Listen in.
Her stand has not been without cost. During her campaign, Kipsomba MCA Mary Goreti Boroswa made the bold decision to disclose her HIV status to the voters. She admits that the revelation nearly cost her the seat. Stigma was immediate and harsh, with judgment and public backlash threatening to end her political journey before it even began. But she refused to back down.
Wakati wa mkutano nikifika kwa hiyo topic, watu wanaanza kuangalia chini, wanaona haibu. Wengi wanasema, oh, unazungumzia tukiwa na watoto, tuko na nini mahali hapa. So wengi walikuwa na ile yani kutokubali. Lakini mimi si kurudi nyuma na nilisema ya kwamba lazima nitazungumzia. Kwa sababu mimi nataka ni support the community. I want to support our country. Niseme nashukuru sana watu wangu wa Kipsomba because all of them knew that I was HIV positive, because there's no day we've gone to a forum and I've stopped talking about myself. I've not stopped talking about my experience. And through that, they elected me. And they had faith kwamba mimi ninaweza.
Instead, Goreti chose to use her story as a tool against shame. Today, she stands firm at the front lines of awareness, challenging the deep-rooted myths and calling for comprehensive sex education in schools and homes. Her message is consistent. HIV is not a death sentence, but stigma can be.
Na nataka niseme ya kwamba hiyo jane si rahisi. In the first place, kulikuwa na mambo ya stigma, kukataliwa na jamii, kuzungumziwa nyuma ya tent, lakini inataka ujasiri wako mwenyewe. Kwa sababu maisha ni yako na kila kitu ni yako. So usipokuwa mtu mjasiri, uta give up kwa haraka sana. Ama utasema heri nife ama uchukue maisha yako ili usione ili shida ya HIV. And saidi ni wakati umeona wale wa kwanza vile walikuwa wanateseka, mtu anakonda mpaka anakuwa mifupa. Lakini currently wewe ukiniona utasema niko na ukimwi. Hata tukisimama na watu wengine watasema hawa ni wagonjwa, Mary Goreti yako sawa.
Goreti's story is now intertwined with these realities. She's not just an MCA, she's a living example that with treatment, support and openness, life continues.
We are not speaking about it in our households, in our communities. Whenever there is somebody who wants to talk about it, people bury their heads in the sand. And that is what is really eating our youths.
The urgency of advocacy is echoed by medical professionals. This is according to Dr. Abraham Koskei, the head of pharmacy at the Fountain Hospital in Eldoret, and Dr. Joy Sawe, a medical doctor and a consultant.
Shida kubwa sana sisi yenye tunaiona ni some patients are not coming for their drugs, which is giving us a lot of problems. Especially when dealing with other challenges.
To statistics, we are having our youth with increased number of new HIV infections as we are going forward. This can be attributed, according to my opinion, on the increased risky sexual behaviors going around.
Nationally, the stakes remain high. According to the latest data from the National Syndemic Diseases Control Council, Kenya recorded an estimated 1.4 million people living with HIV in 2023, with 22,000 new infections that year. Adolescents and young people between 15 to 24 continue to account for over 40% of the new adults infections, highlighting the very crisis MCA Goretti is confronting. Without open dialogue, consistent drug supply, and youth-centered care, the gains made over the years risk being reversed. Elvis Kosgei, KTN, Uasin Gishu County.